all our formatting is actually gone way off. But what I would like to show you is the different aspects of what digital health encompasses. It is a loop, is a closed loop, something that Dr. Sham actually mentioned earlier. And that loop actually begins from, creating something to begin with using sensors, communicating it, aggregating it, analyzing it, acting on it. Now I'm kind of moving away from the medical aspect of health, which actually says get the person in, treat him, and send him back a bit more well than he was before. This is the technologists, the technocrats version of healthcare, that you get to what the symptoms are, measure the symptoms, not just the symptoms, but the condition, get back to communicating it to the right people. In this case, the stakeholders are doctors, effectively. And you aggregate a lot of this data and you start analyzing it and acting on it. So essentially, this is the holy grail, the promise that digital health has continually been telling everybody around the world. A bit of infographic will show you. I think the resolution is way off, so there's a lot that this one slide, this infographic actually tells you, is how health sciences, informatics, mobile, and everything is now shaping up to give you a much better information about healthcare. So awareness is a dual sword, and Dr. Hegde, who's kind of a doyen of what medicine is actually, in 5 words, just kind of flattened everything that is being spoken of into 2 days here. And he said that awareness is actually much worse than ignorance. Simply because if you don't have the disease, you'll start feeling you have the disease, right? And what is happening all around is this propaganda that you have the disease. And all of us start speaking. If you go to somebody or listen to somebody who's talking about sugar, you'll feel you are diabetic. If you go and talk to somebody who says, hypertension, everybody in India has hypertension, you'll think you are part of that everybody. Okay. So this creates a certain mindset that keeps us all scared, good for business actually. And that's what people are doing, building businesses around this kind of fear and putting them out. What truly actually is the genesis, and all of us need to be educated, and our governments are much more responsible for educating us than that, is when technology comes to play, it is actually giving you a certain level of information about what's happening to your body. And each of us own our own body. So you have the right to decide what's wrong and take action with clear information at your fingertips. And somehow all of this is now going to converge. We've talked about even all the 4 tracks that we saw prior to mine are all converging to give you or us as a human much more knowledge about our own bodies. Brings to me a very poignant thing called the hype cycle, and somebody defined it very, very well. And trust me, as at the receiving end, I've been an entrepreneur who's actually showing the world what an innovation is in the true strength. All the time, we are completely disappointed by people referring to the hype cycle more than the reality cycle. So, in the hype cycle, the everything that you hear of, Apple Health, I can't see the screen very well, but I'd like to explain to you that all these terms you have heard now, they are in the general. It's like on the radio. Okay, I throw one term at you and you'll say yes, we heard about it. Okay, but the reality is none of it has actually even reached you. And I'll come to later. I mean, we are in the developing world. This hype cycle in the developed world also has failed its entire course, taken a lot of money from venture capital, and still no real effect to the end customer or the human being. My problem, or the entire thing that an innovator or an entrepreneur needs to go to, is sustain this kind of hype cycle. Okay, you have to let everybody die down and still stand there. And for that, what you need to do is something I'll tell you what in the real sense that means. let's come down, because this is a conference, even though international. I think the the crux of everything we do is related to India. And about 10 years ago, when I decided that we will make something in technology, I said it has to be done in India to show the world that two things. These are this is the place that needs it the most, and this is the place that has to show the world that it can create the technology and not just consume it. Okay, that dream is far from uh, I think I give a very clear synchronym there, that that dream and reality is as far away as the liquor shop and the highway, right? So for the for the guy who wants liquor, that distance is like, miles apart. So uh, you have all these statistics coming all in all. I don't repeat that, but the only way to bridge this now is actually making these forays into health using digitization and using technology, and created ground up for India, because no other thing. I mean, though healthcare is one size fits all, Dr. Kamath actually showed us that it's not one size fits all. India will have different aspects of the same medicine, and the European will have different aspects of the same medicine. So India cannot just pluck stuff from outside and say, I'll do it here. Okay. I'll still refer to something that is being widely disruptive world over in terms of digital health. And I picked up 4 innovations that I feel really show you the broad aspects. So don't think about just devices, there'll be systems as well. Uh, One of the main things that I think going forward in the world is prosthetics, and this company. And one thing more is, I know for real these companies exist. They are actually selling that product, and it's not just a small media outlet or a YouTube video that's saying that, oh, we've made this. Okay, there are enough people already using these, and these are sustainable companies. So you see prosthetics that are fit with microcontrollers and are not just left at being a Jaipur foot with no intelligence at all. You've seen the Paralympics being run with people with prosthetics. I think that's the biggest human achievement we've had ever since. Uh, you have that company doing different kind of prosthetics. By the way, if you look up their sites, you'll realize how different they are. Then you have the artificial heart. This artificial heart is supposed to be the bridge till the time a donor heart receives you, and this could be over 9 months or so. Uh, they have statistics. See, every such innovation has to fight the market, fight the existing mechanism, because it's all skeptical. They don't know that this can work. And ultimately, these are the people who receive this kind of innovation, put it in their body because they have no other objective, or they have no other choice. And then they live through and say, this worked for me. Okay, so that unfortunately very slow pace. This company has fitted in over the last 9 to 12 years the number of heart it does, and it has to go on a very small pace. This is, by the way, the only FDA approved artificial heart available in the market. So this is something you can tell your doctor, go and pick up. The other part of digital health is, something that I feel affects all of us, personalized metabolic. So I'm picking up these things because, two things. I've got an X-ray vision on, what needs and what is really an important thing if you use it correctly. So this one is like a personalized metabolism service, which tracks you along with a simple phone app, no devices, no hardware. But then throughout the day, and this works on the same principle that your metabolism and the person next to you has a different metabolism. And if you trace it over a longer period of time, you can actually start judging, what your metabolism will be at different hours of the day. And then you can take better decisions on your diet. You can take better decisions on what to eat, what medicine affect you, things like that. So as a technologist, I feel this is always going to be the way forward. The last one, of course, who can miss wearables nowadays? But the right kind of wearables actually are the ones that can give you clear indicators. So if you've heard, so BitBite that you see here is a ear clip. It's not to, it looks like a ring, but it's actually a ear clip. And it will actually check for your eating habits. Okay. So all these used to be magic, and unfortunately it's still treated as magic because it's not there in your hands right now. these companies have to go crowdfunding routes and all that. They don't have any state mechanism, uh, even in developed countries, to back them. And which means that most of them have to appeal to the general public, because each one is in charge of its own health, who thinks, no, this should come to reality. So coming back to India, we have this very unique problem that we always, as an entrepreneur, and on the other hand, okay, so this is not something as a general Indian that I look at, but as an entrepreneur, we've seen that, the biggest problems people have in India is they pay out of pocket. So you have to be very sensitive to what your innovation is about. Uh, the other thing is that there is almost zero awareness. In the rural parts that I see, people are living with a diabetic condition for 20 years without knowing that their sugar actually spikes up. And by the time they actually reach a doctor, not a hospital also, a simple doctor, they are irrecoverable from what they are suffering through. So, and nobody likes to be aware of their sicknesses, but then you are talking of a population that's aging, population that's young and leaving its lifestyle habits aside. The other part is, of course, we'll rush through that, but another part, the biggest one, is availability of anything that you want. I mean, if you wanted an artificial heart, it's not there in India, okay? It's not there for you to say, okay, doctor, please fit me with an artificial heart. This is like an extreme, but nothing else actually even exists. So even in the last mile rural area, and the government is trying to do stuff, but I know for sure what's the humongous challenge that goes beyond it. But distribution is the trader's biggest strength. So whatever he distributes reaches the customer. It's not what the doctor asks that reaches the customer. It's not what the government wants reaches the customer. So you have a big mechanism that actually drives what is being touted as healthcare assistance in the country. So a few lessons that, and these are real world lessons that I learned on the way, 10 years of things. This is also for all those who think healthcare would be kind of a great business to enter into. Always remember that it's beyond business or technology. It's the business model innovation that can get you. So which is why you saw a mix of what Dr. Sham said is not just about the measurement, but actually putting it in place, doing value addition on the way, and charging for the value addition, because everything else exists. Channels are important. In India, we are all struck by the entire view of how do I reach Jharkhand from here. Okay, so if you don't have the channel strength, you are limited to what geography you can just reach overnight. Okay, that's India's biggest problem. The other part is there is no centralized distribution for private kind of devices. I mean, there would be in the US there are these bodies that pick up a device and say, of course, it has to go through all the things, but they say the distribution is taken care of centrally. This does not happen here. And of course, like I said, 10 years I'm still working on a very meager cash-strapped salary. So the only thing that drives us is the passion and wanting to do stuff that India badly needs. So anybody wanting to know that even the government is planning to define a medical space startup or a healthcare startup as something that can exist from 5 to 8 years. For all other things, it is just 3 years, okay, from inception. And that's because simply on the ground, it's impossible to create something, put it on the ground, create more iterations, and still have a viable business model in just 2 or 3 years. So coming back to what we did, and something that is on the ground, we have a program. I started making devices earlier, but I realized the problem was much bigger. It was even to the last mile, having nobody taking those devices and doing stuff. So the problem got solved in a program that we run called Arogya Sakhi, where obviously she's the Asha-like volunteer, but she's not the Asha volunteer. And again, She is semi-literate, probably 10th pass and so, and she goes all the way and has stakeholders all assisting her using technology. Uh, when you use technology, then you have an Asha or a Arogya Sakhi dashboards look like this. You know how what you are treating with. So this is giving great insights to stakeholders, saying that hey, something's wrong with this entire population. A lot of them are diabetic, or a lot of them are obviously in India. A lot of them are anemic. So you can take very specified decisions based on data that comes to you. If you see this, unfortunately, until you see this picture, that's not a hospital, that's not a clinic, but it's on a small pathway on the village. This is what we kind of achieved through Arogya Sakhi. She had a tablet, telemedicine, a lot of stuff to carry, and she was trained in using all of these things. And if you see, all the tests are done in very, very casual environments. She's doing testing. I am, I mean, before medical people raise up their hands, I know that it is impossible to have the setting that you define as hygiene and medical in where all this is needed. So it's always done with some great training done by partners like Dr. Mankar sitting here, and also having some protocols to solve that end problem there. Being vernacular, being very regionalized, not hanging up to, I hate it when I do a couple of biochemistry tests and all I get is numbers, numbers, numbers. What do those numbers mean? For somebody who's at half a healthcare technologist, I can make do. But last mile, again, this asks for something like getting down to the last mile. And again, medical statistics to help it. Final thing, when I started the journey for ECG, I never knew it would be this difficult. And what in the end I realized that all the tenets of what Dr. Sham said, the affordability, the 4As and all, have to come to the device in iterations. And what best then to dilate that to the smallest level. So what I'm going to show you is I've been hooked onto a ECG machine so far, and a machine that I've actually made in India, in Pune. Okay. This is equivalent of the GE ECG machine or Schiller ECG machine, like in what he mentioned to be in quality terms. And this was India's calling. Okay, there cannot be a machine that's bulky, 5 kg, and travel in India and solve the things. I made a machine that was still the lightest, 400 grams, and I knew I could be pushed further to make the next machine. I waited for the mobile revolution to catch on, so now the machine is actually connected to mobile. I have been hooked to electrodes all this while. Yeah. All this while I was speaking, probably nobody noticed that I was actually having an ECG machine in my pocket, and I don't need a tablet really for this. Any phone, because it's an Android app, and this is the distillation of the needs to be put through real practice. This machine does not require a battery. It works off your mobile phone, because whatever said and done, whatever said and done, we always charge our mobile phones before we charge anything else. Okay, so the mobile phone always has power. And small snippets, I realized the enormous, enormous attachment we have to our phones nowadays. Okay, what we can do is now this kind of device turn every phone into an ECG machine. Okay, there's a lot of things that go around it, is creating the awareness that what can be done with an ECG. If somebody falls on the ground, what would you do with an ECG? Okay, not getting into medical jargon, but making it very simple, like just transmit this number. I don't need to explain to you that after the ECG is here on the machine, what all can I do with it? So it travels, it streams, live, everything is possible. Trust me, the first time I did this, it was the same ECG machine, but in a different avatar. So what you see is this shift of avatars, and eventually now becoming more personalized. And that's the dream that I actually bring to the table.
that was fantastic, Gautam. Very nice of you to, huh? Yeah, very, very nice. Appreciate your entrepreneurial spirit. I think we need more people like you. Our next speaker is Dr. Shiralkar. He's a consultant NHS UK. Thank you very much for coming all the way. And he's going to talk about innovation in medical learning. Thank you.
Thank you very much. When I was listening to all the previous speakers, such a distinguished speakers and their interesting topics, I thought that I may need to spend some time in highlighting how important my topic is and how different I am from them. The first thing is I would say is that most of them, I believe, are guest speaker. I'm a host speaker. I'm involved with Symbiosis in developing and taking further their clinical skill lab. So I'm kind of homegrown. The second thing, let me tell you why I am particularly interested in this topic, especially learning, because all the previous speakers spoke about innovation strategies. Those are going to be useful for millions and millions of individuals. But at the same time, I remember the first slide where you put in for the pharmaceutical 15 years and billions of dollars, and then you come out with 1 to 2 drugs. Yeah. My topic is different. If you just make difference by teaching and learning to one individual, it is for rest of not his or her life, for millions. So it is the other way around. So that's how my topic is important. And firstly, for all these innovations, what we have discussed for, unless there is a change in thinking and behavior of the individual, things won't work. And that's how it is important. And although the title is medical learning, this is applicable for learning in general as well as for all the health professionals. So I haven't restricted it just for medical learning. And secondly, about myself, I have practiced, worked in India, in Pune, in US, and in UK. So I have learned and I have experienced all the health systems. And I will tell you about myself. Another unique aspect is I'm a surgeon and also I'm a psychiatrist. And let me tell you my interesting life story. I practiced here and I went to UK to learn advances in surgery. I did my FRCS. And I wanted to specialize further. I wanted to learn something which I can bring back to our country, which would be very helpful. So I decided to work in head neck cancer surgery. For that, I went to States. And there I came across a field called as psycho-oncology, which is to do with psychological aspects of cancer patient. As everybody can understand, the psychological impact of just the diagnosis is significant. What I saw is that all the technological sort of innovation, all the surgical techniques we used to operate on 12 hours to 14 hours on a patient, and the impact, the outcome wasn't that great. What made the difference was the psychological support for those patients, and that improved the life expectancy. So I thought that, yes, we have got fantastic technicians, technical surgeons, but this concept wasn't there. So I started working in psycho-oncology. At the same time, I had a car accident, I broke my neck, I developed neurological problems, which made me unfit to continue surgical career. So I retrained myself in the psychiatry or mental health. So I have a sort of dual experience and qualification in surgery. I didn't stop there. When I started working in mental health, I realized that if I would have known certain psychological principles as a surgeon, I could have been a better surgeon. And that was a kind of eureka phenomenon for me, and that's where the learning comes from. So I started teaching other surgeons how to improve their performance by learning psychological techniques, and that's what I have been doing for the last 10 years. I've written books which has been appreciated by the British Medical Association as the best surgical book. So that's where, and I have written other books. And this is the principle and this is the concept. I want to bring it here, and that's how I have been involved with Symbiosis, and that's what I said, that I'm a host speaker. Usually, whenever I go abroad, there is a customary, at least in medical conferences, to declare conflict of interest, that whether you have any conflict of interest. In this case, I would say that my interests are not conflicting, but they're complementary. Two, it is with a symbiosis, and secondary, my surgery, my learning sort of techniques, because as I said, I started learning in mental health at the age of 40, so you can understand. And that's since then I have been interested in how the learning capacity or the learning can be improved at every age, every stage, at any stage of the sort of career of a health professional. With that introduction, let me start with the topic. Right, so it has got complex sort of aspects, as well as it is a multidimensional, as it is multiple impact on the individual, professional, and the society on your patients. So this is how complex it is, and that's why the innovation in learning, especially healthcare learning, is very, very important. The another apt point for this presentation over here is that it is under Symbiosis University. So being a teaching sort of university association, it is apt that we have to say about what are the things, what are the innovative things that a teaching faculty should know about. Right. This is how important it is, and any teaching or any innovation, especially education innovation, has to be considered on these aspects, whether you as a learner find it helpful. Otherwise, it's of no use. However, bombardment may be done, but if you don't find it as an individual as an interesting, it's of no use. It starts with a basic thing, and then how the learning is provided, what is the impact, which can be tested by performance, examination, and all those things. And we have to be realistic in this current world, okay, atmosphere. Everything is related to money. Whatever money, time you spent in, what are the benefits? And that is the last one. That has to be considered by the strategist, by the opinion leaders, and all the top sort of leaders of education, okay? So, if there is any innovation, any technique that has been impactful for last 3 years, if you consider the 3 major innovations in education and learning, what they could be, according to me, if you want to know the top 3 innovations, they are simulation, simulation, and simulation. Nothing has changed as far as the healthcare learning is concerned than simulation. Not from only individual perspective, but from societal and organizational perspective as well. Why is it so? As far as the medical teaching is concerned, or healthcare teaching is concerned, experience is quite important. Now, without experience, just by learning from books and seeing, it doesn't work, it is not effective. You have to experience. That's what we have been taught when we were undergraduate, but now the concepts have changed all over the world. Now, I'm going to ask you a rhetorical question. I believe you know what the rhetorical means. You know, the rhetorical means that the answer is already there in that question. Okay, so I know the answer. Now, I believe that none of you would accept anything less than optimum treatment. If at all you have any health concerns, yeah, so that's a rhetorical question, okay? I believe how many of you would be willing to be a guinea pig for an experimental for the healthcare treatment? None of you, okay? So what's the solution? You want the best treatment in the world, but you don't want to be the first one to be tried on. What's the answer? That's the simulation. So you have to create a system by which all the treatment could be tried on without the risk. And that's where this simulation has come up. So what exactly this simulation is? The simulation is creating a real life scenario where the learning can be done by immersion. Now, what is the meaning of immersion? It is as if that's what is happening around you. You have to create it. It is a kind of virtual reality. You have to create it. The advantage of it is that you not only get immersed in the situation, you become reflective. You start thinking, and that is the best part of learning, and that's how the learning should happen. And that's the difference, that's the advantage of learning by simulation and learning by real life experience. I'll come to that later on, why simulation learning could be better than actual sort of experiential learning. Now, at the same time, now I'm going to show you some clips. This simulation, is it just mannequin? It's the virtual reality simulator? Yes, it is, but it is not just that. It is not just technology, it is the technique. How you use, and all the gadgets we have learned that it is not just good use of creating those technological things. It is the application, how you use it, user friendliness. Those are more important. Same thing applies for the simulation learning as well, simulation technique. It is not however big, however costly, expensive equipment you can buy or you can learn on. It is the way you learn on it. It is the way you have been taught on it is very important, and the effectivity depends upon that. I had a video clip in between. Has it been taken out? Okay, we'll come to that. They may have already cut down my timing, so. Okay. So what are the drivers about this simulation technology, simulation training? Firstly, societal expectation. Everybody wants the best treatment in the world, but nobody wants to be guinea pig. Nobody wants to be experimented upon. Then there are technological development, which we have just seen, and reducing the training time. Now, we don't have time to spend on learning because the knowledge is expanding. We can't keep on learning for 10, 15 years of our life. So it has to be reduced time. How can we learn all these things? So there has to be some alternative method of learning. And the changes that are happening. Now, when I was trained as a doctor, what we were told is just be clinician, that's it. But that is not useful anymore in life. I mean, what we have seen in our current medical or health system, just being a clinician is not enough. Just being a nurse is not enough. It is the team working, all also like technicians, administrators, clinicians, paramedical, all of us has to spend, we don't have time to sort of spend that much time in learning. So all these changes have compelled for us to consider alternative method of learning and training. Sorry. What's happening? Okay, right. How this simulation is taught? There are various ways, right from creating a clinical scenario in the classroom. Sorry? Video is not there? Okay, because I present, when I gave the 4 videos, anyway, they might have got. There are various ways that simulation training can be done, right from classroom. Then there are dissections, and there are simulated patients like actors and mannequins, which you have seen. And yesterday, the clip that you saw from Symbiosis, you have seen those mannequins. And now with the computer-generated graphics. And now, why this simulation learning or simulation training is better than ordinary classroom or even experiential learning? The first thing is that the efficacy of learning is good or better if it is done with a deliberate practice. Like for example, now, if you want to learn a venipuncture or if you want to learn a tying a knot, you can learn that while operating or while you are assisting, or for nurses who want to be phlebotomists, you can learn it by practicing on the patient. Whenever the patient comes in, you start learning. That's what we did. Now, for you to become a good in particular skill, you may take 10, 15 times that you have to learn, you have to do that, and when you become expert, okay? But that 10, 15 times, you don't know where you are going to get it, okay? So unless there is a deliberate practice, you won't get advantage of learning, and it has to be deliberate. Any learning experience has to be deliberate, otherwise it won't work. That's the advantage. With simulation, it is a deliberate practice, and the research has shown that, for example, if you want to learn a phlebotomy, how to take a blood, say if you want to use, say, 25 patients, if you do it on a simulator, just by 10 attempts, you can achieve the same experience. That's the difference, and that's the beauty of it. Secondly, when you're working, when you're hands-on working, your focus is on achieving that task, not necessarily learning, and that's unfortunately our limitation of the brain. When you're doing something with a simulation sort of experience, you have got a better capacity to focus on what exactly needs to be learned. Thirdly, when you're learning, again, when you're tying a knot on a patient, when you're operating, if you're making a mistake, it is not the time to tell you that you're doing this thing wrong. And if you don't tell particularly while you're doing, you will continue doing the same thing for 100 times before you're told, oh, this is the wrong thing. That's the beauty of learning on simulator. You are told, you are given a feedback straight away, which is the most important thing as far as learning is concerned. When you want to change a behavior, when you want to change your action, if the feedback is given there and then, the impact is better, okay? And then all these things can be combined in the conventional curriculum. It's not separate. the simulation learning doesn't have to be separated from the experiential learning. In fact, that is the beauty and that's the advantage, that if it is combined with the existing learning, clinical learning, then the outcome, the benefit for the learner is far better. That's why this simulation training is boom in the current innovation practice. Is it just a talk? No, there has been evidence as well. There's a plethora of books, and not only for doctors, for others as well, even for administrator and everybody. There has been a lot of research done, and it is evidence-based. It is not just a talk. Few points about the evidence. There are benefits for learners in evidence. So all this research has been carried out, and to see actually whether it is worth investing that much time, energy in all this simulation training. So it is yes. And secondly, as I said, it is not very important how much money you are spending on the simulator. What is important, the last statement, is that the way the teaching is done, the explanation. And so it is very important to understand what is the training style, what is the learning style for someone to get the benefits from the simulation training. Application. It is not only useful for medical and nursing training, it is application. The application goes for allied faculties, that there are a lot of things that have been used for pharmacy, that how to, because for learner in a pharmacy, they don't know how the clinical things work. So they can have a good experience about how it is. Unfortunately, the videos for some reason are not being shown, but I had that fantastic video clips just to have a idea how this simulation training is useful for all the healthcare professionals, right from operation theater, pharmacy, and delivering the care. And it is not just the clinician. As I said, that nowadays the healthcare is delivered in teams, not in silos, not just one clinician, not just one professional. So all the team, like for example, in operation theater, when we perform operation, it is not the surgeon, it is the nursing assistant, it is the theater assistants, and all the anesthetists. So all of them can be trained in that simulated environment, which is far more effective, rather than anesthetist learning his or her way, the surgeon learning their way, the nurse is learning, the training is done. It is being done in developed countries. And I'm sure why it can't be done in our setup as well. In fact, that is the need of the time. And more than that, nowadays they're giving the simulated experience to the patient. Like for example, if a child who's been diagnosed to be suffering from cancer, and if the child is undergoing chemotherapy or a radiotherapy, which is life-saving, many times the children are not, understandably, they are not prepared to undergo that treatment. And sometimes they refuse and they lose their life for that. So they have developed simulated patient experience scenarios so that the child is made comfortable and the child undergoes to the treatment. It is just one example. And lastly, it is not just healthcare professional, it is the societal education as well that has been carried out with the simulated experience. Like there has been a terrorist attack, there has been a disaster, there is a disaster management. So all these things, again, I had a fantastic clip about how these disaster management training is done with the simulator at a societal level. That's how the preparedness has to be. The terrorist attacks and other disasters can be managed far better, and this is what, again, it has been practiced. So it's all about this understanding and knowledge, but what are we going to do? As I said, I have been associated with Symbiosis, and we are in the process of designing this state-of-art clinical skill laboratory or simulation hub in this setup. You have some of whom have been there yesterday must have seen, but I'm just going to show you that we have been working on it. We have trained thousands and thousands of healthcare professionals with this technique. I must admit that the state-of-art technology hasn't arrived yet, but it will soon be here in next few months or years. Okay, so this is the proposed skill lab. And so the conclusion, simulation is here to stay. The only way for the simulation or simulated learning is the arrow shows going up and up. And there is a lot of infrastructure needed for having the best outcome from the simulation training. And that's it for me. Thank you very much.